My name's Sarah, I'm 31. I lost my little boy Joel last year at Chesterfield Royal, and this is my patient story. I was 11 months pregnant, I woke up on my due date and I felt like he weren't really kicking properly. So I telephoned the ward at Chesterfield Royal and they explained that I should come in for extra monitoring. So when I went in, they hooked me up to a heartbeat monitor and it was silent. So then they transferred me into a scanning room, and that's when we found out that Joel had passed and they would be stillborn. It came completely out of the blue. I'd been perfectly healthy through my pregnancy, he'd been fine, there was never any doubt that he would come home. So it really was a shock to all of us when we found out that this had happened. I was introduced to the midwives and they explained to me what would happen and what to expect. And I was able to have all of my family around me. They came onto the ward, and whoever I wanted while I was in labour, I was allowed to have people around me, which was nice to have that support. And looking back, I absolutely loved my labour. Even though that's a really odd thing to say, I really loved my labour, and it was hard and it was painful, but it made me his mum, and ultimately being Joel's mum is what makes me proud. He was born at 3:20 on the 3rd of October, 8 pounds 3, perfectly formed, absolutely beautiful, and I have nothing but love and pride when I think about him. My experience of giving birth in Chesterfield was wonderful. It was everything that I could want, even for the sad outcome that it was. The actual experience and the care that I got was above and beyond. For me, there was nothing that could be changed over my actual inpatient care. When I got discharged, I realised that that was it. To say that I was a woman that had just given birth, there wasn't any of the usual checks that should be in place, let alone extra checks for the fact that he was stillborn. I kind of started making a list of all the things that they could do different, that could be done different to help people in this situation. I got in touch with Linda Gustard, who's the head of midwifery. And I had a meeting with her and we kind of went through it, and she agreed to quite a lot of it. And then from there, the booklet idea kind of developed on its own, really. I had the idea of the booklet from a book that I'd got on baby loss, and it was almost people's experiences, and it wasn't just stories, but it was kind of tied to different milestones on holding a baby for the first time, or your partner going back to work. There were so many times that I thought, oh, thank God it's not just me. It was nice to know that what I was feeling was normal. I kind of wanted to introduce that to normal people, and if it was something that the hospital could just give out when it happens, then you're going home a bit armed with some information on what to expect. So when I talked to Linda, we kind of thought, because I'm suddenly in touch with lots of people that it's happened to, you kind of become a club that no one really wants to be a part of. And I thought I can use all these women's experience. Everyone's desperate to talk about their experience, and I can pull everything together, collate all these experiences, and kind of give people a heads up on what to expect. I think it was pot luck, really, that I fell on someone as good as Linda, that believed in the idea and that is good at a job and wanted to help people that are in my situation. And I think we've kind of come together of me having this knowledge and Linda having this experience and position, and we've kind of been able to make it work together. And I think we're both a bit shocked, really, that it has come off. Since losing Joel, I've worked really hard at changing the stigma of stillbirth. I talk about him, I speak his name. If people ask if this is my first pregnancy, I say no, and I say that she'd got an older brother and what happened to him. And if it can help a few people that go through this, then that can only be a good thing.